Good morning. Let me start by doing the disclaimer. This is not going to be an easy YouTube. I'm not pretending it to be. It's morning, and I just want to tell you, my dear friend, what I've been going through. It's an update because perhaps you might also go through this, and also because it helps me. It's morning, and I have been awake for quite a few hours in a lot of pain. So my doctors have decided that I have been on quite a few medications for some of them 20, 30 years. And it's time to turn a new leaf, get rid of some of them, and see what they are actually doing. So we are getting rid of some medications to see if they're actually doing what they're supposed to be doing and moving on to either new medications or if they're actually doing something, then back on them. So I'm going to give you names of medications. It doesn't mean by any means that you should be on these medications or off them. Okay? This is just my life experience. So I have been on gabapentin or Neurontin for, like I said, probably 20 years, over 20 years, because of IIH, intracranial, idiopathic intracranial hypertension. You're going to have to forgive me because I am under a lot of pain. I have great coping mechanisms, but I am under a lot of pain right now. And this is medicated already. So I have been for about 3 months now, decreasing this medication, gabapentin slowly. So I started at the highest dose that I am on or have been on, that I understand one should be on. But if you are on a higher dose, just go with your doctor. I was on 1800 milligrams. In other words, 600 3 times a day, morning, midday, evening. So I went down 100 milligrams every 3 or 4 days. And today is my last day. In other words, today will be my last day taking the last 100 milligrams. Woohoo! The issue is the pain is excruciating. Basically, I have been on a detox for the last 3 months. My doctor my neurologist has been really good at telling me how to manage things, that sometimes I'm going to need to go up, then down again, that, maybe it's better to take a lower dose in the morning or in the evening, in the midday. So there are strategies to do this. But what I'm here to say is there is a physical component to getting rid of a medication when your headaches just get worse. And it's not just your headaches, because you start to realize what other pains this medication was masking or getting rid of, taking care of. Like, for example, it's making my occipital neuralgia worse. I have been diagnosed with fibromyalgia, so it's making other body pains worse. I have been getting leg cramps, which I guess when you get rid of medication like this, it can show up. So, things like that. It can also, of course, affect you emotionally. You're getting rid of a medication and you are in a lot of pain. So, emotionally, it's hard because it grinds at you and it can be demoralizing because you're getting more pain instead of less pain. So, you're going to a doctor to ask for help with pain, and instead, you get more pain. This does not help emotionally, my dear friend. What I also wanted to bring up today, though, is the fact, sort of something I don't think many people talk about, which is the psychological effect. When one is under such severe detox, um, especially for such a long time, there is a mental effect. There is you have to be very strong mentally. There is a mental effect. When I talk about this grinding emotionally, there's a grinding mentally. And what I mean is all your fears come up, all your doubts. I guess some people call it the shadow side. I don't know if it's the shadow side, but your monsters in the closet come up and they come in knocking. When your body feels like it doesn't have what it needs, meaning the chemical, it asks for it. And when it is not given, it's going to push you in every direction. So please be prepared if you're going to go through something like this, to go to the nth degree. And you really have to be prepared in willpower to say, this is what I want. And this is what I wanted. I thought it was a great idea to get rid of some of my medications. This is not the only one I'm going to get rid of as a trial, but it is extremely wearing and tearing. Also, be prepared to nurture yourself somehow. And I am terrible at this. So I have to learn. I mean, my taking care of myself is coping mechanisms that are not good. For example, overeating. That's what I've done all my life. This is what I was taught as a child. Oh, you have a headache here, eat some more. So I have to be very careful and very mindful, which also doesn't help, right? Because in that moment of struggle, the last thing you want to do is deal with another coping mechanism. So I need to give myself a break. I need to be very compassionate with myself. I have improved at this greatly, believe me, through years of so many techniques that I've mentioned in other videos, right? Of being a Reiki master teacher, so practicing Reiki, practicing meditation. You know that now I practice the GSR technique, which has helped tremendously. I'll tell you more about that in the future. So many things that I have worked on. So thank goodness for that, because if not, I don't know where I would be right now. But at the end of the story, when you are alone with your pain and the little voices come up, the little voices come up, and you don't have to deal with them. You can't just sweep them under a rug day after day after day after day. And they can drive you mad. And if you do want to, if you do want to get rid of a medication, truly detox, you don't only have to get rid of it, you have to go through it. And going through it, man, is it tough. So I'm here to say this is not something many talk about. Let's talk about it. It does not mean you're crazy. I know I'm not crazy. It's a natural process. It doesn't mean I am a drug addict. And what if I were? Let's cut the labels out in the sense of being so terrible. Um, can we please open the lids and start discussing the things that are so natural in this process? We are in pain, our bodies hurt. And these are the things that happen because we are in pain and our bodies hurt. Let's face it, pain, chronic pain, is not pervasive, it's constant, and it needs to be paid attention to, not ignored. This morning, I'm having a very difficult time. As you can see, one of my coping mechanisms is to be logical, to talk to you one little step at a time and one day at a time. Things will improve. They have to. No other way back. I will keep posting and telling you what's happening. Thank you for listening and thank you for being there. This is my relentless story of life. It's been a long, long road. Thank you. Bye bye.